Have you ever woken up with joint pain so severe you couldn't even button your shirt or hold your morning coffee? For millions of seniors with arthritis, this isn't just an occasional inconvenience. It's a daily reality that steals independence and joy. But what if I told you that the foods on your plate might be secretly making your arthritis worse? Today, I'm going to reveal the 6 inflammatory foods that are silently intensifying your joint pain and stiffness. But more importantly, I'll share the hidden root cause of arthritis that your doctor probably never mentioned: excessive fibrin buildup around your joints. Before we dive into these inflammatory foods, let's understand what's really happening in your body when you have arthritis. Arthritis is more than just wear and tear or an autoimmune response. While there are over 100 different types, the 2 most common are osteoarthritis and rheumatoid arthritis. Osteoarthritis occurs when cartilage deteriorates over time, while rheumatoid arthritis involves an autoimmune response that triggers joint inflammation and can affect other organs. But here's what most doctors don't tell you. The underlying cause of persistent joint pain isn't just inflammation, it's excessive fibrin buildup around your joints. What is fibrin? It's an insoluble protein involved in wound healing that forms the foundation for clots, scabs, and scars. When you experience an injury, even a minor bump, your body dispatches white blood cells to the area, causing inflammation. Then, fibrin creates a resilient mesh-like web that seals off the site and initiates healing. Normally, once healing is complete, fibrin breaks down and inflammation subsides. But in arthritis, fibrin continues to accumulate in blood vessels and connective tissues surrounding the joints. This excess fibrin thickens and hardens, forming scar tissue that restricts blood flow and oxygen, slowing the healing process and causing prolonged stiffness and pain. This is precisely why pain medications become less effective over time. They're treating the symptom inflammation, but not addressing the root cause fibrin buildup. Even worse, excess fibrin doesn't just affect your joints. When fibrin accumulates in your circulatory system, it hampers the delivery of oxygen-rich blood throughout your body. Your heart has to work harder, your blood pressure increases, and your risk of heart disease and stroke rises. Now that you understand the true cause of arthritis pain, let's look at the 6 foods that make this fibrin buildup worse and intensify your joint pain. 1. Processed and fried foods. The first inflammatory food that seniors with arthritis must avoid is processed and fried foods. These include fast food, packaged snacks, frozen meals, and anything deep fried. Why are these foods so harmful for arthritis? Processed and fried foods are typically cooked at high temperatures, which creates compounds called advanced glycation end products, or AGEs. These compounds directly trigger inflammation in your body and accelerate the aging process. When you consume foods high in AGEs, they bind to specific receptors on your cells called RAGE receptors for advanced glycation end products. This binding activates your immune system and triggers the release of pro-inflammatory cytokines, which increase inflammation throughout your body, especially in your joints. But here's what makes this even worse for arthritis sufferers. These inflammatory compounds also stimulate the production of more fibrin around your joints. Remember that mesh-like protein I mentioned earlier? AGEs actually increase its production while simultaneously slowing down your body's ability to break it down. A study published in the Journal of the American Geriatric Society found that older adults who consumed the highest amounts of processed foods experienced a 40% increase in inflammatory markers, compared to those who ate mostly whole foods. Instead of processed and fried foods, choose fresh, whole foods prepared by steaming, boiling, or light sauteing. These cooking methods produce fewer AGEs and won't contribute to fibrin buildup around your joints. 2. Sugar and refined carbohydrates. The second inflammatory food that's wreaking havoc on your joints is sugar and refined carbohydrates. This includes white bread, pasta, pastries, sodas, candy, and even seemingly healthy options like fruit juices and many breakfast cereals. When you consume sugar or refined carbs, your blood sugar levels spike rapidly. In response, your body releases insulin to bring those levels back down. This sudden surge of insulin triggers the production of pro-inflammatory molecules called cytokines. For arthritis sufferers, this creates a perfect storm. These inflammatory cytokines travel throughout your bloodstream and concentrate in already sensitive joint tissues, causing increased pain, swelling, and stiffness. But the damage doesn't stop there. High sugar consumption also leads to the production of those agents we just discussed, creating a double whammy effect on your joints. A groundbreaking study published in the American Journal of Clinical Nutrition found that participants who consumed just one sugar-sweetened soda per day had a 63% higher risk of developing rheumatoid arthritis compared to those who consumed no soda. What's more alarming is how sugar affects that fibrin buildup. Sugar actually makes fibrin strands thicker and more resistant to breakdown, creating an even denser mesh around your joints that further restricts blood flow and oxygen. Instead of sugary foods and refined carbs, choose complex carbohydrates like sweet potatoes, quinoa, and oats, which release sugar more slowly into your bloodstream and don't trigger the same inflammatory response. 3. Red and processed meats. The third inflammatory food that seniors with arthritis should avoid is red and processed meats. This includes beef, pork, lamb, and processed meats like bacon, sausage, hot dogs, and deli meats. Red meat contains high levels of arachidonic acid, an omega-6 fatty acid that your body converts into inflammatory compounds called prostaglandins and leukotrienes. These compounds directly increase inflammation in your joints and throughout your body. Processed meats are even worse because they contain both arachidonic acid and chemical preservatives like nitrites and nitrates, which create a double inflammatory effect. A large-scale study published in the journal Arthritis and Rheumatology tracked over 25,000 people and found that those who consumed the highest amounts of red meat had a 25% higher risk of inflammatory arthritis compared to those who consumed the least. For seniors with arthritis, the connection to fibrin is particularly concerning. The saturated fats in red meat increase the stickiness of platelets in your blood, making them more likely to form clots and increasing fibrin production. This directly contributes to that mesh-like web around your joints that restricts healing and causes pain. Instead of red and processed meats, choose lean protein sources like fish, especially fatty fish high in omega-3s, poultry, legumes, and plant-based proteins, which don't trigger the same inflammatory cascade. 4. Salt and preservatives. The fourth inflammatory food that's exacerbating your arthritis is salt and preservatives. This includes not just table salt, but also the hidden sodium in canned soups, frozen meals, condiments, and most restaurant foods. Excessive salt consumption leads to fluid retention in your body, which increases pressure on your joints and exacerbates pain and swelling. But the damage goes deeper than that. High sodium intake disrupts the balance of your immune system, pushing it toward a more pro-inflammatory state. This imbalance increases the production of inflammatory cytokines that target your joints. A study published in the journal Clinical Rheumatology found that participants who followed a low-sodium diet experienced significant reductions in joint pain and stiffness compared to those who consumed higher amounts of salt. For arthritis sufferers, salt's effect on fibrin is particularly problematic. High sodium levels actually strengthen fibrin networks, making them more resistant to breakdown. This means that the fibrin mesh around your joints becomes even more persistent and difficult for your body to clear away. Food preservatives like sulfites, benzoates, and MSG are equally problematic. These chemicals trigger inflammatory responses in many people and have been linked to increased joint pain in arthritis sufferers. Instead of high-sodium processed foods, choose fresh, whole foods and flavor them with herbs and spices, which often have anti-inflammatory properties themselves. 5. Omega-6 fatty acids. The fifth inflammatory food that seniors with arthritis must avoid is foods high in omega-6 fatty acids. These include vegetable oils like corn, sunflower, safflower, and soybean oils, which are found in most processed foods, salad dressings, and fried foods. While omega-6 fatty acids are essential in small amounts, the modern Western diet contains far too many omega-6s and not enough omega-3s. This imbalance is a major driver of chronic inflammation. When consumed in excess, omega-6 fatty acids are converted into pro-inflammatory compounds in your body. These compounds directly increase inflammation in your joints and throughout your body. What makes vegetable oils particularly harmful is their susceptibility to oxidation. When exposed to heat and light, these oils become damaged through chemical reactions, turning rancid. These oxidized oils significantly contribute to inflammation in your gut lining, joints, and blood vessels. Even worse are artificial trans fats, often labeled as partially hydrogenated oils on food packaging. These are found in vegetable shortening, microwave popcorn, margarine, and many fried fast foods. A study published in the Journal of Nutrition found that participants with the highest ratio of omega-6 to omega-3 fatty acids had significantly higher levels of inflammatory markers compared to those with a more balanced ratio. For arthritis sufferers, the connection to fibrin is clear. Excessive omega-6 consumption increases the production of thromboxane, a compound that promotes blood clotting and fibrin formation. This directly contributes to that restrictive mesh around your joints. Instead of vegetable oils high in omega-6s, choose healthier fats like extra virgin olive oil, avocado oil, coconut oil, and grass-fed butter, which have anti-inflammatory properties. 6. Gluten and casein. The sixth inflammatory food that can worsen arthritis symptoms is gluten and casein. Gluten is a protein found in wheat, barley, and rye, while casein is a protein found in dairy products. For many people, especially those with sensitivities, these proteins can trigger an immune response that increases inflammation throughout the body, including in the joints. When your body perceives gluten or casein as a threat, it produces antibodies to fight these invaders. This immune response triggers inflammation that can affect your joints, even if you don't have celiac disease or a diagnosed dairy allergy. A study published in the Oxford Journal of Rheumatology demonstrated that 41% of participants with rheumatoid arthritis experienced improvements in their symptoms while following a gluten-free diet. For arthritis sufferers, the connection to fibrin is significant. The inflammatory response triggered by gluten and casein increases the production of fibrinogen, the precursor to fibrin. This leads to more fibrin formation around your joints, further restricting blood flow and oxygen. If you suspect you might be sensitive to gluten or dairy, try eliminating these foods from your diet for 2 weeks and observe any changes in your joint pain and stiffness. Then gradually reintroduce them and monitor your body's response. Instead of gluten-containing grains, choose alternatives like rice, quinoa, and gluten-free oats. For dairy alternatives, consider almond milk, coconut milk, or other plant-based options. The solution: proteolytic enzymes. Now that you understand the 6 inflammatory foods to avoid, let's talk about the solution to break down that excess fibrin that's causing your joint pain. The key lies in proteolytic enzymes. These remarkable enzymes, also known as proteases, break down proteins, including excess fibrin, into smaller, more easily digestible units. One of the primary functions of proteolytic enzymes is to break down the excess fibrin present in your circulatory system and connective tissues, including your muscles and joints. By eliminating fibrin and scar tissue, these enzymes improve oxygenation and the delivery of nutrient-rich blood to your tissues, removing metabolic waste that contributes to pain and inflammation. Although your body naturally produces proteolytic enzymes in the pancreas, their production significantly decreases after age 27. This is why many seniors experience increased joint pain and stiffness as they age. Their bodies simply can't break down fibrin effectively anymore. Fortunately, you can obtain proteolytic enzymes from dietary sources or supplements. Two excellent food sources are pineapple and papaya. Bromelain from pineapple and papain from papaya have demonstrated effectiveness in reducing pain, swelling, and joint stiffness in individuals with arthritis. Other foods rich in proteolytic enzymes include kiwi fruit, figs, ginger, asparagus, and fermented foods such as sauerkraut, yogurt, kefir, and miso. Beyond their role in fighting inflammation and pain, proteolytic enzymes serve other significant functions such as relieving muscle soreness, expediting wound healing, regulating blood pressure, boosting the immune system, and even combating viruses. Let's recap the 6 inflammatory foods that seniors with arthritis must avoid. 1. Processed and fried foods, which create agents that increase inflammation and fibrin production. 2. Sugar and refined carbs, which trigger inflammatory cytokines and make fibrin strands thicker. 3. Red and processed meats, which contain arachidonic acid that converts to inflammatory compounds. 4. Salt and preservatives, which cause fluid retention and strengthen fibrin networks. 5. Omega-6 fatty acids, which promote inflammation and increase fibrin formation. 6. Gluten and casein, which can trigger immune responses that increase inflammation and fibrinogen production. By eliminating these foods from your diet and increasing your intake of proteolytic enzymes through foods like pineapple and papaya, you can begin to break down the excess fibrin around your joints and experience significant relief from arthritis pain. Remember, arthritis doesn't have to mean a life of limited mobility and constant pain. By understanding the true cause, fibrin buildup, and making these dietary changes, you can take control of your joint health and reclaim your active lifestyle. If you found this information valuable, please hit the like button and subscribe to our channel for more evidence-based health advice for seniors. Thank you for watching, and I'll see you in the next video. Until then, here's to your health and pain-free movement.